We will be reviewing lidocaine as a transdermal patch. So I'll be going over uses and mechanism of action. So what is lidocaine? Lidocaine is a medication that belongs to the pharmacological class of local anesthetics, which helps to reduce sharp, burning, aching pain, as well as discomfort caused by skin areas that are overly sensitive to touch. Lidocaine works by causing a temporary loss of feeling in the area where you apply the patch. The mechanism of action for lidocaine is that it works by blocking the influx of sodium into the membrane surrounding nerves. This prevents the initiation and conduction of impulses along the nerve, which results in an anesthetic effect. Basically, this medicine prevents pain by blocking the signals at the nerve endings in the skin. Now, keep in mind that this medicine does not cause unconsciousness like general anesthetics do in surgery.
Lidocaine patches have a relatively quick onset. It takes up to 4 hours for the lidocaine patch to work, but can start working as soon as 30 minutes. The peak of the lidocaine patch is 11 hours, but it takes between 2 to 4 weeks of continuous use to receive the full benefit of pain relief. The duration is unknown and varies depending on the patient.
Some adverse effects to look out for: central nervous system, lightheadedness, anxiety, confusion, dizziness, tremors, and headache, drowsiness and seizures, cardiovascular, bradycardia, hypotension, CV collapse, cardiac arrest, shock, and edema, GI, vomiting and nausea, respiratory depression and arrest, skin, dermatitis, rash, erythema. Also, some side effects for patients to look out for include blistering, crusting, irritation, itching or reddening of the skin, cough, cracked, dry or scaly skin, fast heartbeat, hives or welts, itching, skin rash, tightness in chest. If any of these do occur, let patient know to call their doctor or advise them to call 911.
Post-marketing cases of seizures, cardiopulmonary arrest, and death in patients younger than age 3 have been reported with use of lidocaine 2% viscous solution when it wasn't administered in strict adherence to dosing and administration recommendations. Lidocaine 2% viscous solution is not approved for teething pain.
Lidocaine is only supposed to be used externally and shouldn't be applied to any areas where there are breaks in skin or on infection sites. There are some formulations that contain the ingredient benzyl alcohol, and these should be avoided in neonates. This is because it can cause metabolic acidosis, respiratory distress, gasping respirations, CNS dysfunction, hypotension, and cardiovascular collapse. Polysorbate 80 is an ingredient often used in pharmaceuticals, cosmetics, foods, and may cause a delayed reaction to lidocaine. It is important to monitor for drug toxicity and regularly assess patient vital signs, as well as level of consciousness. When removing the patch, fold it safely so the adhesive sticks together. Patches should only be used if there is a high need for it during pregnancy because it crosses the placental barrier.
Teach patient how to properly store, administer, and dispose of lidocaine patch. It should be stored in original packaging. Apply patch on clean, dry, and intact skin. Dispose of patch after 14 days. When disposing, fold patch in half without touching the inner portion of the patch. Keep patch out of reach of children. The lidocaine patch should only be kept on the body for 12 hours out of a day. Seek medical attention for signs and symptoms of allergic reaction such as rashes, hives, difficulty breathing, and dizziness. Lastly, teach the patient to avoid the contact of water. Water will remove the patch and decrease its effectiveness.